Welcome to another episode of the Peak Potential Success Show. My name is Fong, and today we have another great guest. I've had the privilege of seeing her speak live on stage in front of thousands of entrepreneurs and business CEOs, speaking on a topic that's very, very important, which is how mental health support is being put out there, especially for children. Hence why one of her main concerns and main focal points is to help transform how neurodevelopment and also mental health support is being delivered in across education and also clinical settings as well. She's also out there removing systemic barriers and embedding support where children live and also learn, making coordination better and making in-environment care better as well, so that they're bringing in the together the families and the support and the professionals so that they're all there to achieve more meaningful outcomes for the children. She's been placed in a lot of great leadership roles where she's been a big impact on lots of multidisciplinary services, from psychology to speech pathology, occupational therapy, amongst many other things that makes it hard for me to say those words because they're so long and lots of syllables. So I'll let her explain more about that later. So please welcome Managing Director of Nexia Healthcare, registered physiotherapist, Ms. Cindy Wong.
Thank you so much, Fong, for that amazing introduction. Really glad to be here today to be able to speak with you and be able to, I guess, bring more awareness to mental health and the neurodivergent population as well. I'm not quite sure how it is over there in Canada, but in Australia, we do as much as we can to be able to support this population and get people the access that they need. But there are still, unfortunately, some barriers for the children and even for adults to be able to access this care.
Well, thank you very much. Like I mentioned before, hearing you speak on stage that day and also having the ability to chat with you afterwards and before that, you raised some very important concerns and also stuff that lots of people aren't very aware of. And I think let's attack the first question is what exactly is neurodiversity and also neural development? And lots of people don't really know what that term is. So let's start off from that.
I guess if we talk about neurodivergent, we're talking about those who, or neurodivergent population could potentially be those who are diagnosed with ADHD or autism, so on the autism spectrum syndrome. And with that, there are also children who are not yet diagnosed. So that's when they become, more so in the developmental delay component of it in the early intervention, because a lot of children when they're young, usually below the ages of 6 to 7, it is quite hard to officially provide them with a diagnosis. And occasionally as well, they might not necessarily have a diagnosis. It could just mean that they've got a little bit of delay in some of their milestones in development. And so what we try to do is to be able to support them early on. So take on that more proactive approach to be able to support them so that maybe into the future they might not need that, extensive ongoing care, or if they do require it, then we're here to be able to provide them with that support. But I guess if somebody mentions, look, I am neurodivergent, it could suggest that they do have ADHD or autism. And with autism, there are different levels. You can't always necessarily pick it out, but there's, you can be level 1 or you can be at level 3 as well. So it does vary because it is a spectrum.
Is this something that you try and kind of identify very, very early on with especially with children?
Yeah, so as early as it is appropriate. So for children, what we normally have as part of our service is they will always engage with a psychologist, but the person who would actually make the diagnosis will be the pediatrician or child psychiatrist, because they're the ones that are holding that clinical governance within our organization, and they're the ones who look at, okay, I've read the report from the psychologist who's provided that provisional diagnosis. Can I now also, back that and also see that there is, let's say, for example, autism that is present and that can be diagnosed. And diagnosis can be a little bit harder if they're, the level 1 or around the level 1. But, with level 2 and level 3, it is very important for our pediatricians to be able to separate in terms of which level they're at, because it does make a difference, especially in Australia, in terms of how much support they can potentially get. And autism looks different for everyone. You can have two people who are have autism level 2, but they are presenting very differently and have very different sort of concerns or needs.
So for parents out there, what are some of the signs that they need to kind of look out for before they even think about taking their child over to get like an assessment?
Like I said, there are a lot of things that come to play. But I think it's instead of it's just, one thing or another. We might have children who are struggling with some emotional regulation. So, the smallest little things can potentially trigger them. And, and changes of environment as well can have a huge effect. I think for anyone on a norm, when we are in a different environment dealing with something new, it's a lot to take in. And you can imagine if there is a child, for example, who is neurodivergent, but they haven't been taught the skills or the strategies to be able to manage or handle these situations. That's when, they would sort of really act up. But in terms of signs and symptoms or what you might see, it does really much vary. And that's why we do have our psychologists to be there to review. We look at not only their medical history, but developmental history, and also how are they presenting at home or in the classroom. They might be great at home, but in the classroom, there's so many changes, so many, usually sometimes when they start a new school year, you've got new kids in your classroom, you're in a new classroom, or you've got a new teacher. All of that adds to it. And some children are, quite good at managing and learning to adapt, whereas others struggle a little bit more. So that's why there are layers to how we do our assessments to ensure we've got the complete understanding and having a comprehensive assessment. And then our pediatricians or our psychiatrists will then go ahead and do the next assessment. But it is worth, if there is anything that you notice and you're concerned about, feel free to speak to your GPs, and they will be able to direct you into the right direction. And if, nobody's sort of really giving you the answers, and we have, parents come through, it's like, oh, I'm struggling with this, but, some people have mentioned it might just be, a child growing up, or, it's just tantrums. But I think it's important to listen to your gut feeling. If you think that further investigation is needed, and if it is just so happens to be a tantrum, that's fine as well. But what you want to ensure is that you're providing your child with as much options to be able to succeed as possible. So you want to make sure you're doing the what is needed, if they do need a bit more support. And what I would say is maybe some parents might be getting advice from like their childcare centres or teachers as well. And they might not necessarily have a medical background, but they do work with children every day, and they do bring to the parents' attention if further investigation might be worth considering. But ultimately, it's up to the parents, and there's always medical professionals out there to look for support. And us here at Nexia, we have clients who come through to say, look, I think my child needs a little bit more support. I don't think he or she necessarily, fits along the diagnosis criteria of ADHD or autism, but I think they just need a bit more advice from a specialist. So then that's when we just get them in, and they can have a consult with our specialist, and then they can organize the next steps. If the specialists consider that it's important to maybe consider exploring some of the assessments, then they would be recommended down that pathway. If not, it might just be, look, this child might need a little bit more behavioral support, a little bit more attention in this area or that area, and that would be the recommendation.
You mentioned before, and it was one of the questions I had in mind, is that sometimes people don't think it's a concern. Sometimes they go, yeah, this it's just kids growing up. There's new environment. They're excited. That's just the way it is. Especially like my generation, our parents weren't thinking about stuff like that, and they just
Of
kind of
course.
classify it as, oh, they're just excited or they're just learning or
Yeah.
that's kids being kids. So for people like
And it could
me, it may not be a concern. So would you say that these types of assessments should be one of the, let's say, checklists of something that parents should take their kids to do regardless?
I don't think we should put it in the sense that it should be a checklist, but you just need to really work with your child. And sometimes it is kids being kids. I can't remember, when I was growing up, sometimes I just really wanted something and, might just choose to throw a tantrum, but it doesn't necessarily mean that, there is neurodivergence there. But I think what is important is just, yeah, if there is something that you're noticing and it constantly keeps coming up, same triggers, or, you're trying to provide your child with strategies and it's not really getting anywhere and you see that they're struggling, that's when I think it's important to reach out to someone or anyone. And it doesn't mean that there is any sort of neurodivergence associated, like I said, but maybe this child just needs to be provided with some of the like management skills. Like some children are more sensitive to, I guess, certain sensations, right? So, sorry, like sensory inputs. So things like lighting, different textures, loud sounds. And, we're already, quite, I guess, how do I put it? Normally when we're in different situations as well, we're looking at the different lights or the people around, and sometimes it can be quite overwhelming. And we just have, as we grow up, you might learn to cope with it and learn how to manage and adapt. But some people do struggle and some children do struggle, which is why it's very hard to kind of quantify or necessarily say these are the criterias, sorry, these are the symptoms or these are the signs that mean that they're neurodivergent. That's why we need our psychologists and also our psychiatrists or pediatricians to do that evaluation, to really understand. And like I said, it's quite hard when the child is a bit younger, which means unfortunately it leads to a lot of delay in them being able to get the right support if they, are neurodivergent, because it's really hard to diagnose when you're young, especially a lot of research has found that with females as well, they're better at sort of masking some of their symptoms, and they're a little bit better at kind of coping. So they usually don't get diagnosed until a later stage compared to males.
Is this something that you've realized or noticed that as the generations pass, that this is a growing concern? Has it been kind of affecting the workforce? And that's why people are starting to look at, okay, this group is starting to grow as we look at the generations going by.
I think in terms of generations, what we are finding is nowadays a lot more, like I said, adults are reaching out to get the assessment done because it is affecting their work, it's affecting their relationships, and it might not have been something that they've considered in the past. But I think the good thing is that ADHD or autism is now more spoken about than it was, 10, 20 years ago. And I think people understanding that, a child is not just a bad kid, there might be something more to it. And I think it's the education that's slowly sort of rolling out and people understanding, that there's more to it than just this child is a bad kid, or I, I'm sloppy, or I can never pay attention, things like that. I think it really does help now that a lot more adults are getting or having that assessment, or there is more conversations about it. I think it's a lot less taboo nowadays, which gives people the opportunity to reach out and not feel, I guess, a certain way about things. And I think as well as we kind of grow into um, this society, we're realizing the importance of also putting ourselves first and not thinking that we're the problem. Sometimes it is important to pay a bit more attention to ourselves and look for the support when we do need it.
No, you're going out there and trying to transform the way it's delivered, the support that's being done. What have you found as the lacking element that you're noticing in which it needs a modification so that better support is out there?
Yeah, so what we actually found was, at least within Australia, we've got a great, sort of healthcare system to be able to provide, you know, everyone with being able to gain access to the support that they need. However, because there's a lot to do with, neurodivergent assessments or mental health support, the system itself can be quite an extensive wait list, and some people or some children are waiting, 4 5 years to get an assessment, and by that time they almost outgrow the system. And you can imagine during the time where they're not getting help, the families and the parents are struggling, the child is struggling at home, the child is struggling at school, but they haven't really gotten any answers. And one of the main things is also, if they're looking to seek support privately, there are a lot of clinics out there who have psychologists who can provide that initial assessment, which is more so a provisional diagnosis. So a lot of psychology clinics will offer, I guess, a provisional diagnosis, but in order for the diagnosis to actually be formalized, you will need a psychiatrist or pediatrician involved in many cases. And a lot of, I guess, the general population don't know that, and they go in and they engage with a clinic, thinking that they will be able to come out and have an official diagnosis and potentially access medication if it's appropriate. But without a formalized diagnosis, they won't be able to access that. And so I think what we're trying to achieve here as well is to really spread the word in terms of what is required and what we can provide, and really just give them a lot of the clients the confidence to say, hey, look, if it is appropriate and your diagnosis is appropriate, we will take you through the process and complete, and you can complete it with us, and not feel like, you're sort of halfway there and then have to find another clinic to engage with a pediatrician or psychiatrist. And the wait list again is very extensive. It can be, a few months to a year as well. So as part of Nexia, what we're trying to do is, and what we do have is our psychologists, pediatricians, and psychiatrists all under the one roof to be able to have that sort of seamless support for the clients, so that we can actually carry them through the journey and they don't have to worry about anything other than showing up and being themselves. And from there, we will do the appropriate assessments. And sometimes, a diagnosis is not really appropriate, and that's fine as well. Or some people get a diagnosis and they say, look, I don't actually want to be on medication, but there's so many other aspects to support, which is why we've got our occupational therapists, speech pathologists, or ongoing psychology support to be able to provide these clients with what they need. So it's never only, one option. There's always multiple options that we can explore. And that's why we've got, our specialist team to help guide us and oversight the team to ensure that we're actually taking these clients in the right directions.
No, I understand this is probably a case by case basis. So let's say if somebody comes in and they were diagnosed with, let's say, level one, two, or three, what does that plan kind of look like? Is it more like the goal is to get them to a certain stage so that they don't require a constant like monitoring, or is it going to be monitoring throughout kind of thing?
Yeah, like you said, it is very much case by case. For example, with some adults, on top of, let's say, if they were diagnosed with a neurodivergent diagnosis, there could be a lot of other layers that might potentially add to, the way that they react to certain situations, or how they show up to work or within their relationships, whether it's, also trauma in the past and etc. So when you do come in to see the psychologist or psychiatrist, they're there to understand, okay, what are your main concerns? and what is actually contributing to this. Is it really the neurodivergent aspect? So is it the inattentiveness, or is it the rigidity? Things like that is what they look at to really understand what is the best way to I guess what is the best intervention plan to move forward with. And I guess the other thing to consider is yeah, on clients' journeys, they might, whether they get a diagnosis of level 1 or level 3 autism, sometimes medication is not always appropriate, especially for children. And a lot of parents don't like to put their children on medication, which is completely fine. So what we can do to support is, we've got our occupational therapists, speech pathologists as well. They work on communication and social skills. Because for a child, if you think, they're going through their childhood, what matters most to them, being able to build relationships, being able to be like the other children and form those, I guess, solid friendships, right? But when you're looking at a teenager, finding a sense of belonging as well could be a component that they're looking for. Or are they dealing with a lot of changes in their life? Are they moving from city to city? Things like that is what, it's really hard to really say what is the best way and what gets involved. But, that's why within our integrated service, our occupational therapists, speech pathologists, psychologists, and like I said, our specialists, they all work collectively together. So in any time, let's say following an assessment, the specialist says, look, this child would really benefit from occupational therapy because they are, struggling with a lot of sensory issues. We will bring our occupational therapists in, and they might not have any issues with communication or necessarily speech delays. So we might not need the speech pathologist, but in a scenario that they might need it, then we've got the whole team there. And we do a lot of multidisciplinary team meetings, client to client basis, to ensure that if the child is within our care, all the clinicians are in the same room having the same conversation to understand that we're not only targeting one aspect of the child's concerns, we're targeting all aspects, and we're seeing the child really holistically as a whole. And on top of that, one of the other things that we do is, like I said, the way the child presents at home or at school or even at home versus at work can be very different. So, we do our best to really try to engage with the educators as well to understand, okay, are these the struggles that he's having at school? Okay, how can we best provide him with the strategies to manage those in the classroom? And how do we also empower the educators as well to be able to, I guess, manage and understand, what to do when I guess a child is, potentially having a meltdown or is a little bit dysregulated. How can they best support them so that they can keep their classroom flowing the way that they intend, and also the child is getting the right support that they need in the environment that, they do feel comfortable and supported.
And when your team jumps in and starts lending the support that people need, do they work hand in hand with the general physician as well that they first got like recommendations from?
You mean so
Like
from the
normally,
specialist?
yeah, but like normally somebody would probably go to a doctor's, like their day-to-day family doctor, and it's probably the doctor that then recommends that, hey, you might want to go get an assessment done. So once that's done, does your team work hand in hand with the physician as well, the family doctor, or how does
Yeah,
that
so
usually go?
it really depends what is required for, let's just use a child, for example. Let's say the mum reaches out to the doctor to say, hey, look, I've noticing this, and the doctor suggests, look, it might be worth considering an assessment. And if they move forward with that, they will see our psychologists and pediatricians or adult psychiatrists. And in that time, whether a diagnosis is I guess, eventuated or not, we will always send a letter back to the GP to let them know, hey, this is what's happening. And with the recommendations from the pediatrician, sometimes, there's medication involved, sometimes there's not. Or if the pediatrician, like I said, recommends occupational therapy or speech pathology services, it's good to always incorporate the family GP to let them know, hey, this is what we've sort of recommended. The family is planning to do X, Y, Z. We'll give you any updates when it's relevant. And if they, start to go through and receive therapy from us, and there was always going to be those touch bases where we give the GPs a bit of an update.
So in Australia, is this whole process and all the support that's being provided something that the government is supporting, or is it all privately, like people have to be out of pocket for?
Yeah, so for like within Australia, a lot of our healthcare is supported by the government. And like I was mentioning earlier, we do have a public mental health care service. However, there is an extensive wait list, which is why a lot of, parents or adults, they eventually go into look for private options like ourselves because they just need, there's just that urgency to be able to get the support that they need. In terms of seeing a specialist, there, like, Australia does have, I guess, partially bulk billed or Medicaid services for those sessions, but there is still an out-of-pocket fee. And, I guess that's one of the things within our clinic is we try to our whole goal is to improve our accessibility to these clients and to this population. So, understanding that sometimes an out-of-pocket cost can be a little bit tough for some families or some individuals. So we have options as well to be able to, I guess, still be able to see them, but provide them with a little bit more of a financial support.
Do you have any, are there any studies or any theories as to why? Is this just a natural thing that people are born with, or is there a reason why more and more of this stuff is being talked about or being assessed? Like, is it the way we're being brought up now? Is it because of environment? Is it because of technology? Like, what is it that's causing like a rise of this type of condition?
In terms of, I guess, genetics, there is a little bit of a correlation with family members, parents that might also be neurodivergent, and has sort of, and you'll find that also maybe the children have it. In terms of technology, I don't think there's enough studies out there to really highlight and identify whether there is a correlation. But one of the things I think is clear is although there's maybe an increase in diagnosis or increase in diagnosis, I think it's also because a lot of people are open to getting the assessments. It's becoming a lot more I guess, yeah, less taboo. But it does vary from country to country, right? Growing up, like you said, and different cultures as well, do I guess have different opinions or like different ways of being able to support the child, and you might not necessarily be going down the pathway of an assessment. But I think now more and more people are a bit more open to it, to understanding it, and that's why the diagnosis numbers are potentially increasing as well.
So aside from bringing awareness to the support and mental health, what else are you looking for right now? Like how else can people help your cause?
I think just being able to have an open conversation about it. One of the things that we are finding is a lot of adults or individuals are struggling by themselves. And first off, they don't know who to reach out to. They don't know what the process is in terms of getting an actual diagnosis. So, like I said, some client individuals will engage a clinic thinking that they're going to be able to access, the right support. However, they're almost just halfway there before they need to find someone else. So having that education and understanding of what is required to actually get a formalized diagnosis and what does that mean, I think it's really important for people to ask the right questions, like, coming out at the end of these assessments, what does that mean for me? To ensure that you really understand, what you're engaging in. And it's completely fine to go to a psychology clinic and have a provisional diagnosis, because you can take that and go to see a specialist and get that formalized if it's appropriate. But just understanding that there's potentially a bit more of a wait time. And I guess the other thing to be aware of is our educators. It's not talked about as much, but in the childcare centres, or even sometimes like in early education, a lot of the educators are burnt out because there are children coming through with neurodivergent or neurodevelopmental delays, but because they don't have the right support, they're struggling themselves, and the educators are here trying to support them, but they don't have the skills or the strategies to be able to do so. And sometimes as well with the educators, they're trying to speak to the parents to be like, hey, look, I think it's really worth you to consider. But they almost sometimes get disregarded because they don't have that sort of medical background. And so what we're also trying to do as part of Nexia is to really engage with these early childcare centre educators to give them, a little bit of skills and education on what to potentially look out for, or if there is a constant concern coming up with one of the children or a couple of the children, how to best manage that. And so we're hoping that if we can build these relationships with these childcare centres, it also gives the parents the confidence that if somebody was to bring something to their attention, it might be worth considering as opposed to just brushing off. And that's one of the things, some of the educators have brought up to us, is it can be quite frustrating because they can see the child and they want to be able to help the child, but to be able to do that, there are some next steps that need to be taken.
Now, I know your main focus is in Australia. Have you had contacts or conversations with people like other physicians and other experts in like the States and Canada and all around the world about what you're creating here, and also how collaboration could be done?
Yeah, definitely, definitely. So we've had conversations with schools within Singapore and Malaysia. Um, I think in every country you're sort of dealing with something similar. And a lot of it is just accessibility, education and understanding of what needs to be provided. And there are different wait times in different countries, but I think the ultimate thing that we are finding is there is still that gap for that population, and they're looking for support, and they're really needing that support, but they just sometimes, there might be too much red tape, or too much like the wait time in some of the government systems are too long, or the price and the finance component of things is a little bit too hard. So then that's another barrier for them to be able to access it. So we're just trying to figure out ways that we can start to support these children, like, creating a neurodivergent, like inclusive childcare centre, so that, parents can know that if their child is in those centres, that the educators are well educated to be able to provide the child with support without feeling like your child is falling through the gaps. And unfortunately, that's what a lot of families do feel. I get a lot of calls from parents to say, hi, look, like I just really need support for my child. Their current childcare centre says that, look, I can't support, like they can't support him or her. They need more specialized attention or one-on-one attention. But again, that comes at a different cost to the parents as well. And when you want to find that support for your child, but you can't because of, potential financial barriers, but your current childcare isn't able to support them. It's just multiple things, and they're just constantly getting told no, and it's really hard to hear. And so, from our perspective, we want to do whatever we can to be able to provide them with that access. And but one of the things that I did miss to say, in terms of Australian healthcare system is, you know, sometimes if they get certain diagnosis, we've got a national disability scheme that's actually able to support like ongoing care. So that really does help a lot of the parents and families out, and even individuals as they grow older as well. So there is that level of support, but I think there's still a lot more that we can do. And in terms of access, it does vary in different countries.
So, you mentioned some individuals may or may not have access to the support that's needed. What would you recommend for those parents to do in the like interim before that support is there? What is it that they can do at home with their kids so that it either helps or uh, yeah, helps before support comes?
Yeah, so there's definitely a lot that is out there. There's a lot of support groups that are, on the internet, or even community support groups as well. And it could just be understanding, you know, going to workshops that are, based around neurodivergent, and some of them are free as well. So not all of them come at a cost. And, for example, within Nexia, we run multiple free webinars just to spread the word and provide parents with a little bit of support or strategy to get some skills and see if it is appropriate. But I would recommend that at the end of the day, every intervention is tailored for the child, and one thing that works for one child might not work for your child. So it's definitely worth to seek professional advice or medical professional advice. Speak to your GP. They might say, look, it might be a monitoring thing, or they can refer you on to the right people and at least get that ball rolling. But like I said, there's multiple free webinars out there that provide the education, a lot of forums as well, and community pages as well to be able to support you in the meantime.
Yeah, that's one of the beauties of this day and age and technology is that if you need to find a group of supporters and a community to be a part of, it's always out there. And just being involved with that group gives you that peace of mind of you not being alone. Um, so one of the things that you're doing is you're going out there, you're bringing awareness, you're speaking, you're on stages. Is that something that you've always kind of thought you'll be doing, or were you thinking that, oh, I'm just gonna be working on this, focus on this, on the technical stuff, and then now all of a sudden you're on stages speaking to people around the world?
Yeah. It wasn't something that was sort of planned in the works, but I think our vision and our mission was always to spread the word. And like I said, I think education is really important. Awareness is very important. And whether you get a diagnosis or not, or whether your child just needs support, it's just understanding like who to reach out to for the first step. And I think that's what a lot of parents struggle with. So I think in the pathway of trying to spread the word and engaging with different people and understanding that it's not just as well Australia that might be struggling with this issue of delayed assessment or diagnosis, but it could also be other countries, and being able to go to US and have that speech. The amount of people actually that came up to me afterwards to say, hey, look, my child is struggling with something very similar, or, I went through a lot of struggles with my child going through their teenage years. We're just trying to look for someone to provide the right support. But yeah, we didn't know where to go. So I don't think that it's an issue of just one country. It's almost global. And so because of that, we know that there is a demand. We just need to kind of spread the word and slowly make our way around, and do our part to be able to, I guess, spread the word first, and then hopefully be able to provide that accessibility to those in that population.
Well, I gotta say you look like a natural up on there. Uh, Great speaker, and I think it also goes to show that when the message is important, And when the message is for the audience and to bring awareness, that once you start speaking, it's natural for you to feel comfortable. And people gravitate to that authenticity and also to the message. And I look forward to hearing you speak more on stages, and I look forward to seeing you spread the word. So thank you very much for all this. Is there anything that you would like to share and any last words from you?
Thank you so much for this, Fong. I think the main thing that I would want to spread is that if you have any doubt or any concerns at all, feel free to reach out to anyone, someone. Don't be afraid to ask that extra question. Um, the amount of support that's actually out there in the community is amazing, but sometimes it is hard to kind of engage when you are worried or concerns or have your own fears. But just know that I guess the population and everyone is here to support you and or support your child. So please don't be afraid to reach out. And like I said, there's a lot of services out there. We've got our goal is to remove, the barriers for anyone to be able to access care via telehealth or in person. There are many options to be able to seek support. So please do so. And if you do have any questions, feel free to reach out to us.
Awesome. Well, thank you very much for that. Before I let you go, I'm going to throw in some quick rapid fire questions for fun and give me the first thing that comes to mind.
Okay, perfect.
It would have nothing to do with whatever we talked about. So,
Okay, great.
all right. So you're stranded on a deserted island, one food to eat for the rest of your life, no consequence. You'll still be in shape and healthy.
I think my answer would be a bowl of pho.
Nicely picked. Hollywood calls and goes, you know what? You're an inspiration, a motivator. We would love to do a biopic of you. Who would you cast to play you?
Oh, that is a tough one. Who would I cast to play me? I'm not huge on Hollywood actors and their names, so I wouldn't be able to give you anyone.
That's all good. So let's say
Yeah.
we'll put you in the movie. Um,
Yeah.
if you were able to win the gold medal in any sport, which would that be?
Triathlon.
One song to listen to on a long road trip on repeat.
I am a Swiftie, so anything Taylor Swift would work for me.
Nicely done. Give me a number from 1 to 4.
3.
1, 2, 3. So the word is tightrope. If you have to use tightrope as a metaphor for success, how is success like a tightrope?
I think for success, you are always trying to balance two things. Personally, for me, success is family, it's love, it's I guess accomplishment and growth. And so to be able to do so, you're constantly balancing different priorities and trying to consistently move forward, and hoping that nothing falls out of balance. So I think that's sort of my way of, it's like you're constantly on a tightrope to success, but it's worth it. It kind of helps you understand and learn what are the most important things in life and what as much as success can look like, growth of a business or financially. I think it really comes down to being able to do what you love with the people you love. And you can't have that if you're constantly heavily on one side or the other side. It's always a balance.
Nicely done. So that's how success is like a tightrope. Once again, thank you very much for everything you shared today and bringing awareness to a very, very important issue. Once again, how do people reach out to you?
So you can find me on Instagram at Cindy Wong Official, or you can reach out to me on LinkedIn, also Cindy Wong as well.
Awesome. So thank you very much again for everybody. Connect with Cindy. And until next time, Cindy, Fong, today is the day to unlock your peak potential. We'll see you later.
Thank you so much, Fong. Appreciate it.